Hey everybody, welcome. And firstly, this is an initiation to Blue Sky as well as our little podcast here on the way she works now. But I do not see my boy Rob here, but I am your boy Lucas, and we are looking at Mr. Charles Gaba as well. In fact, sir, is it Gaba or Gaba?
Actually, we've always pronounced it Gaba.
Gaba. And
Yes.
what's the background there? Because it sounds very much like a city here in Catalonia. I'm not kidding.
Yeah, kind of. Well, actually, Gaba comes from the Hebrew word gabai, and as I understand it, there used to be a town somewhere in Israel. I'm not sure where, but I believe that's where it originated from. Also, a gabai is also it used to be a like an it was a job description, an assistant to the rabbi, I believe.
Yeah.
But I'm a
Oh,
little fuzzy about that. So.
I love this. I had no idea. Okay, brilliant. Let's jump on in because this is all because of my boy Bobby. So, Bobby from the Bronx, what would you say about this as we initiate this blue sky? And thank you, everybody. Thank you, Charles, again for doing this.
Sure.
I'm a big fan of Charles. Him and I have
Oh,
interacted online for a while. His work is absolutely incredible. His fundraising work, his curating of data for the ACA signups. It's all critical, crucial stuff. And I'm just so grateful for you, Charles, to come on with us. And thank you for your patience, most of all. We appreciate it.
Oh, no, no problem. Thank you for having me. Appreciate it.
Absolutely. So I would love for our audience to know more about your work as far as ACAsignups.net. And you want to start us off there?
Sure. Yeah, so basically and this is the very short version, but basically I was a freelance website developer for about a decade, um, through the 2000s. And I mean, I was politically active, but like that had nothing to do with like it wasn't like I did political sites only or anything, just, small businesses and such. But I'm also kind of a data wonk, data hound, as I think they're called. And back in 2013, the ACA had sucked up all the political oxygen for, President Obama's first term and partly into the second. Very controversial, yada, yada, yada. And when they were ramping up to launch the exchanges in late 2013, I was just curious, well, after all this fuss and bother, is anybody going to actually sign up for the thing? And
okay.
um, I expected the news media to be all over that and watching it like a hawk and all that. And when they actually launched, as those who were around at the time remember, it's infamously the website crashed, healthcare.gov. They had a massive technical problems.
I
It was a
remember.
bit of a fiasco.
Do you remember this? Yes.
And I was like, well, it'd be nice to know what's actually happening. And basically, nobody was reporting it, or those who were, they weren't getting it right. Like they were reporting like how many people visited the website, which is useless. That doesn't mean anything. How
Right.
many people are actually enrolling? And so I decided to just do some crowdsourcing on that myself, set up a simple spreadsheet, and and the idea was I was active over at Daily Kos, a progressive, online community. And the idea was I'd have one person in each state would follow eat that state and report back. I did that for a little while. Eventually, I kind of took it all on myself. And next thing I knew, I kind of became Obamacare Central, and there were a lot of healthcare reporters who came to me, like they stumbled across what I was doing, and my data seemed to be accurate and comprehensive, and so they were like, "Well, this guy seems to know what's going on," and it just sort of grew from there. And it was supposed to be just a hobby that was just going to last like for 6 months during the first open enrollment period, and somehow instead this has become literally my career for the last decade. Because I look over time, I started listening to and reading and talking to actual healthcare experts, people in, the medical field, people in the insurance field, yada yada yada, public health field. And I just absorbed knowledge and learned more and more about how the whole system works, and it just sort of kind of grew from there. So.
It's terrific. That's really terrific. And what have you come to find over this period of time in terms of growth, in terms of like the adoption of ACA? And actually, I prefer Obamacare now, since Trump is taking credit for everything the
Right.
Democrats do. I'd rather call it Obamacare because it's
And
well liked.
may I throw a question in there as well? What is the accurate or total, if there is one, of how many people have enrolled?
Up to date, yeah, I guess.
Yeah.
Well, do you mean that are currently enrolled or like over time? Like, because some people they move on, move off.
Currently, let's go currently.
Sure. Currently, as of the end of the 2025 open enrollment period, there were around 20 million people enrolled in Medicaid expansion through the ACA, and that, of course, is what's the very controversial issue that the Republican bill is all about. That's where that's the chunk, the portion of Medicaid enrollment that they're focusing on, that they're targeting. So around 20 million people there. In terms of the exchanges, where you go to healthcare.gov or depending on what state you're in, different exchange sites. The private insurance enrollment, that's a little over 24 million enrolled through the exchanges this year, plus another 1.8 million or so are enrolled in what's called a basic health plan. That's specific to New York, Minnesota, and Oregon. It's an optional program for low income residents that sort of sandwiched in between Medicaid and the exchange plans in the middle there. So all told, it's around 26 million exchange or basic health plans, another 20 million Medicaid expansion, so around 46 million people in the United States.
Wow.
And do you happen to know where more people, like the highest number of people in which states? Like I have the feeling that like this might be, equally balanced, but it might not be. I mean, you have states with r red states with like worser healthcare outcomes and stuff. Do we have like numbers on, and I guess states are bigger, but something along those lines to explain the more.
Absolutely, yeah. And that's also where the Medicaid expansion things comes into play because the states, so the states that have the by far the highest enrollment in the exchange policies are Florida and Texas.
Oh,
Okay.
oh
Um,
God.
Now you're right. Your initial response is, oh, well, of course, the red state. Well, yeah, but there's two things. Well, first of all, those are obviously two
Oh,
of the
it's
largest
nothing because
states.
of that, actually.
Yeah. Part of that is, of course, because those are, two of the largest states in the country,
Of
right?
course, yeah.
California. But the other reason is because those states did not expand Medicaid,
That's
because there are 10
Right.
that's
states, 40 states plus DC have expanded. 10 states, including Texas, Florida, Georgia, Mississippi, and the six others, have not as of yet. And there's a population overlap of people who are eligible for exchange plans, for subsidized exchange plans, if their state did not expand Medicaid. If the state did expand Medicaid, then that population would be enrolled in Medicaid instead. So a big chunk of those in Florida in particular, and let me just look it up here. There's 4.7 million Floridians are enrolled in ACA exchange plans, which is 20% of the population. So over one out of
Wow.
five residents of Florida are enrolled in exchange plan. And again, part of that is because it's just a big state. Part of it is because they did not expand Medicaid. Because I think something like over half of them, if they did expand Medicaid, over half that 4.7 million would be in Medicaid instead. So every time a state like North Carolina last year, they expanded Medicaid in December of 2023, I think. And their exchange enrollment dropped significantly because a big chunk of them moved over to the Medicaid instead. And the same thing would happen, if these states expanded. So, but I will say that Florida in particular, even when you take all that into account, Florida, there's something about the economy. I don't know if they just have a huge number of solo contractors or something, so a lot larger than average percentage of self-employed people. But Florida, that one out of five, that 20% is like easily twice as high as almost any other state as a percentage of the population.
correct. Because just by average percentage, it's about 12 to 13% of the country would have some form of the aid. But apparently, one in five in Florida are utilizing this at the same time that they're ignoring the expansion. So this goes back to another question that I have, not to
Mhm.
mention we have an egregious health issue just in general. I mean, I believe that our country, which is 4.7% of the world's population, consumes nearly 50% of the drugs in the world. So, or damn near it. So then we have Mr. Lipschitz, Donald Trump, saying the other day that he is going to now do this bargaining where we're going to cut it 60, 80, 90% to make it like
Prescription drugs, yeah.
like the world's healthcare.
Mhm.
Is is there any form of implementation or anything that's going to denote that that will actually happen?
Well, with him, that could change 5 minutes from now. You could say the exact opposite
That's
tomorrow.
fine.
So,
Exactly.
I highly doubt there'll be any. I mean, there'll probably be some sort of show, dog and pony show kind of thing where he'll either claim credit for something that's already existing, or something that Biden put in a year ago or something.
Right.
Correct.
Or it'll be just reversing something that he put into place himself. Like,
Right.
like with the tariffs, he'll announce, 100% tariff on China, and then the next day say, I'm cutting it to 50%. It's like, well, it was, that's still 50% more than zero, which, I mean, you're the one who
Right.
put it in the first place. So that it'll probably be something that, yeah, I'm not really expecting a whole lot to come out of it.
He's the overpromise, underdeliver president, right? I mean, it's kind of
So
absolutely ridiculous.
yeah.
So you had
But
mentioned,
Mr.
oh, sorry. Sorry, go.
No, Mr. Gaba, can I ask you one quick question though? Because I'm curious about some of his friends back home. With that original Biden-Harris policy of a cap at 35 a month and no more than I believe 2,000 a year, is that in effect anymore, or that was completely disbanded?
no, that is in effect that's for Medicare. That's for Medicare
Yeah, right.
Part
Medicare.
and for Medicare Part D recipients in terms of the $2,000 cap on
Yes,
prescription
sir.
drug costs. The $35 thing. So the thing about the reason why Trump was able to kind of sort of make that a credit issue is because during his first term, I believe a couple of the drug makers had voluntarily said, okay, well, they basically voluntarily said that they were going to put a cap on it for certain populations or for certain versions of the insulin or whatever, like their older versions or something. And then under Biden and the Dems, that was when they actually codified it and said that, for Medicaid, for Medicare enrollees, it is capped legally at $35, and which applied to all of the Medicare enrollees. So,
Yeah.
yeah, so that's how he said, well, no, that was because of me. Well, no, never.
To build on your point, you had stated earlier that, well, actually in a previous conversation, that Biden had improved and expanded upon the ACA with the Inflation Reduction Act, but at first the
Mhm.
American Rescue Plan. Can you give us the specifics on that?
Sorry. Yes, absolutely. So, the original ACA exchange subsidy formula was never generous enough. It was always basically underfunded because at the time when they were trying to pass the bill at the time back in 2010, it was so narrow, it was so difficult to get through, and for some reason the Democrats had decided that they simply could not go over a certain CBO score. That they had to keep it on the CBO score, and as a result of that, they basically ended up having to reduce how generous the subsidies were for the exchange program. And it's a sliding scale, based on your income. As you you
Yeah.
know as you move up the income scale, it becomes less generous and eventually tapers off. But what they ended up doing was they made it less generous along the entire scale, and then they also added a hard cap so that if you earn more than four times the poverty level, 400% of the poverty level, that it cut off instantly. So instead of tapering off gradually, basically, if you made 401%, which is, I think that'd be around a little over $60,000 a year if you're for a single adult. If you make a little bit over that cap, you have to pay full freight, full price.
Right.
And that's where you got a lot of the early gripes was that it's really not that affordable, et cetera, et cetera. Well, in 2021, the Democrats and the Biden administration, as part of the American Rescue Plan, part of that was they beefed up the subsidy formula. They made it significantly more generous along the whole scale, and they also removed that four times poverty cap so that if you're middle class, middle income enrollee, it's still not as generous because it still tapers off, but it tapers off gradually. So you're still eligible for at least some assistance. And so you don't have to pay more than 8.5%. Of your income for the benchmark silver plan. So that was put in place for 2 years. Then the Inflation
Okay.
Reduction Act extended that out by another 3 years. However, that 3 years, so it's 5 years total. Well, that's coming up at the end of this year, end of 2025. So starting in January, if Congress does not pass a further extension of that improved subsidy schedule, starting in January, all of those 24, well, or 26 million, depending on your point of view, million ACA exchange enrollees are going to be in for a very, very rude awakening. And I actually, if
Higher costs, much
a
higher
very
costs.
yeah, because the thing you have to remember is not, especially for it's really at the low end and the high end who are going to see it the most, I think, because at the low end, if you're low income right now, there are millions of enrollees who are paying nothing or almost nothing in premiums, and then they have a very modest, cost sharing. They have like, a couple $100 maybe in, deductible co-share and co-pays and so forth. So they're going to be going up to I believe around like 2 or 3% of their income. And if you're that low income, going from nothing in
Wow.
premiums to a couple percent can be a huge hit. At the upper end,
Yeah.
if you're middle class and you earn more than 400% to go from paying nothing or I'm sorry, to go from paying 8.5%, in some cases they may be going to paying 20%, 25% of their income in premium, and that's in premiums alone. And I can actually, if you're okay with it, let me just do a little sharing here.
And they don't have a choice. Like, it's not like it's healthcare. It's your health insurance. You have to have this in the United States. It's not a universal healthcare country. Oh,
Uh,
please.
exactly. Oh yeah, I hope that's okay. Yeah, so this is just to give an example. This is here in Michigan, where I live. And I got some charts and graphs in here, but this visual here, this is basically to give an idea. What I did was I've done this for every state, by the way.
This is on your website.
Yes, it is at ACASignups.net. Um, And yeah, I have one of these for every state. And this is an example out of Lansing, Michigan. I have four different households. I've got a single adult, 50 years old,
Uh-oh.
single parent with 30-year-old with an 8-year-old kid, nuclear family of four, 40-year middle-aged, well, 40-year-old couple with two kids, and then an older couple basically just waiting for Medicare, 64-year-old couple waiting to be eligible for Medicare. And this just gives you an idea of how much they're looking at in terms of their premiums increasing. And at the low end, it's hard to see, but again, you're going in some cases 3 times, 2 times, 3 times, 4 times their whatever they're paying today. And at the upper end, for the older couple,
Can
or,
we,
I'm sorry.
for some reason, yeah, I don't see that on my screen for some reason.
Are you not
The
seeing it?
the ACA, it's an ACA
Well,
graph
that's
from the
about
state
a
of
shame. Oh,
Michigan.
there it is.
Yeah, perfect.
Wow.
Okay. Yeah. Yeah. In some cases, like
Yep,
for example,
got it.
a 64-year-old couple
Madonna.
earning just a little over 4 times the poverty level would go from paying $638 a month to paying almost $2,400 per month.
It's
And that's in
massive.
premiums alone, which is insane.
Do we know, and we don't want to get too in the weeds. So I also would definitely want to talk about the historical background going from Howard Dean up to the Act Blue and everything that's going on with the fundraising as well. But do we know which state uses the least aid from Obamacare?
You mean like the lowest percentage of their population
In
enrolled?
Population that necessitates it because maybe they have other.
Well, that's tricky to say because it depends if you're talking about just the exchanges or if you're also talking about the Medicaid expansion portion. Because again, depending whether they expanded or not, it's going to be higher and a higher percentage in one, a lower
Or,
percentage in the other.
yeah.
Um, I know that Wisconsin, I think,
Hmm.
I mentioned Florida has the highest percentage. It's over 20% of the population, even though they have not expanded Medicaid. Whereas I think Wisconsin is the lowest percentage. It's yeah, about 5.3% of the population is enrolled in ACA exchange plans. And again, they have not expanded Medicaid either. So yeah, basically between 5 to 20%,
Wow.
depending on the state.
And your website has very
Wow.
detailed
Well, you said
explanations of this.
I'm I'm sorry, you were talking over each other.
Sorry, bud. Go,
yeah,
Lucas.
excuse me. No, 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 because I was gonna finish that because then we can go into the other stuff about Act Blue and some of the fundraising.
Yeah, so to put a cap on that, essentially, if the Republican Congress and Trump do nothing, by the end of 2025, tens of millions of Americans are going to have drastically higher healthcare costs that are enrolled in ACA programs. And their bill, their big, beautiful bill right now, winds up screwing over people from Medicaid from even getting onto ACA plans. Is that right?
Yeah, and that's something that I just confirmed the other day. That so I mentioned before that there was that overlap population. So you've got people who earn zero to 100% of poverty, people who earn 100 to 138% of poverty, and then people who earn 138 and up. And it's that middle section. So Medicaid expansion is supposed to cover so-called able-bodied adults who earn between up to 138% of poverty. The ACA exchange subsidies start at 100%, and there's a whole stupid story behind that, but they start at 100% and they run up to, well, 400% of the subsidies, expire. That in between that, between 100 and 138, if you live in an expansion state, then and you earn between 100 and 138, you're eligible for Medicaid. If you live in a non-expansion state, then you're eligible for the subsidized exchange plan. But with the current version of the bill, and this could change, because they're changing all the time, who knows?
Sure.
Under the current version, or the most recent version, as I understand it, if you're in an expansion state, you're on Medicaid expansion, but then they put these so-called work requirements in, and you fail to meet the reporting requirement. It's not about whether you're working, it's about whether you're jumping through all the hoops to report that you're working, and
Sure.
you fail to meet that minimum 80 hour per month threshold to their liking, and you get kicked off the program. The question is whether, well, now you're no longer, are you still eligible for Medicaid? And if you are, if they say legally you're still eligible for Medicaid, even though you were kicked off the program, then you would not be eligible for the subsidies. And there's no way you could afford it without them. So, as I understand it, the most recent version, the language of the actual legislative text basically says that if you get kicked off in an expansion state, you do not qualify for either, which would ironically put you in a worse position than if you're in a non-expansion state at all,
Right.
because there you're clearly
And
not.
ironic, excuse me for interrupting, but ironically, would that then not take us with this stupid ridiculousness that we're speaking of? Do those costs not take us back to pre-ACA levels where people were paying exorbitant fees? I recall my auntie paying thousands and thousands a month for certain things
Yeah, I
for
mean
her insurance.
that's the so back in 2017, 8 years ago when they were trying to repeal the ACA, the biggest backlash, the biggest outcry was not so much on the financial side, that is, the subsidy side, even though that's huge as well. But the biggest backlash came about the pre-existing condition side, right? The actual protection part of the
Yep.
ACA, because they were trying to strip
Mm.
away. They're trying to say that, oh, insurance companies can still, that they can go back to discriminating. They don't have to cover you at all, et cetera, et cetera. This time around, it's almost the reverse. They don't seem to be really touching. They're still saying, oh, you can't be, cannot be denied coverage for pre-existing conditions. They can't charge different rates, et cetera, et cetera. They can't discriminate, but we're going to take away the funding, is what it amounts to, which means that, yeah, they still have to take you, but they have to take you at full price, and that full price is through the roof. So it amounts to the same thing if that you can't afford it. There's no possible you could afford to pay full price for that. So, so it really amounts to the same thing as basically being uninsurable. And that
And
leads
they're
Exactly.
moves you to junk plans, and that's a whole other discussion.
and they're gonna save that ACA money and throw it over to the Pentagon and ICE. That's the Republican plan. So the 100 billion, couple 100 billion that's going to cost is just going to go to make an $800 billion yearly Pentagon budget, $1 trillion. yearly Pentagon budget. So
Well,
let
actually, not all of it would go to ICE and Pentagon. A big chunk of it would just go to tax cuts.
Oh,
So,
sure. Yes. Elon, let's Elon needs a tax cut. Listen, these
right.
guys, they need their third budget busting tax cut in 3 decades. This is why I think it's important, me, as a converted Democrat, to vote for Democrats. With that segue in mind,
Okay.
I would love to talk about your work, which is the most impressive to me. On top of this,
Yeah.
is that you're a prolific fundraiser and you've done it grassroots, you've done it on your own. Can you sort
Mhm.
of give us the origin story and how you've worked about and what you've contributed and how you've done it in terms of raising funds for Democrat candidates and elections in your time?
Sure. So basically, during the 2018 midterm cycle, I was just sort of dabbling around with, Act Blue. I have an Act Blue account,
Hmm.
and I was just sort of messing around with some of the options there, and I noticed that basically, as far as I know, anyone with an ActBlue account can create your own fundraising page. So, you've got a candidate that you want to raise money for. You don't necessarily have to just post a link to their website. You can actually create your own page to raise money for them, and promote that. And that way, you get to brag to your friends, "Hey, I raised $1,000 for so and so." Um, and the money still goes to them. It's just that you just get credit for it because it went through your page. That's all. But what
Yeah.
I also noticed that they have a tool that allows you to raise money for more than one candidate. And that's really the key to it is that you can put, and I'm sure you've both gotten these, the emails from, before an email from Bernie Sanders saying,
Right.
split a donation, say I'm promoting so and so and split a donation. Will you split $10 between, them and me, and half of it goes to one and half goes to the other.
Yeah.
Well, it doesn't have to be two. It could be three. It could be five. It could be 20. You can add as many candidates as you want, as long as they have an active, ActBlue account and that's in good standing and all that. You can add another candidate. And so I started doing that, and basically I just started creating a bunch of slate pages. Originally, because I'm a Michigander, so originally it was to push Michigan legislative Democrats. And so, basically I just took a dozen or so districts or candidates who I liked, and I just put them on the same page. And I said, "Hey, donate to these guys, and hopefully we can flip the state house." And it just sort of grew from there. And really, so now I have, and so I eventually, fine-tuned it and expanded it and all that. But so in the 2018 cycle, I ended up raising, I was hoping to raise like $100,000 over the course of the cycle, which I thought was pretty ambitious. I ended up raising something like 250,000, I think. And I was like, wow, that's, hey, not bad.
Nice.
And so in 2020,
Yeah, man.
I ramped it up, and I ended up, and then I added more pages. I made, one for the U.S. Senate, one for the U.S. House, um, one for like governor, statewide, like governor, attorney general, secretary of state, that sort of thing. And I ended up raising over $6 million in the 2020 cycle.
We won
And
that one.
yes, we did. In the 2022 midterms, of course, it's a midterm, so nothing at the top of the ticket, so it wasn't quite as successful. It was around 1.3 million. And then this last cycle in 2024, I expanded even more. And what I did was I created a fundraising page for every single state, for all 50 states, even the ones that didn't have anyone on the ballot. I at least created a page for, like, just say, well, they're not up this year, but in case you want to give money to like the state party, here you go. Um,
Mhm.
and I ended up raising over $13.5 million for over
Wow.
600 candidates at the federal, statewide, and state legislative level. Um,
We did better in those. We did a lot better in those. We won Senate seats, we won state house seats, like we're unpredictable, but that's amazing, man. But you're burying the lead is the fact that it's a story of social media being used for good. It's literally just you on your social media pages doing this.
yeah, I'd say there's probably two leads. I'd say one is beyond like the numbers or the amounts. One is that I have done this without sending a single text, without sending a single email. I have neither bought nor stolen, nor borrowed, nor taken any sort of a mailing list. I just through social, basically, I just create these pages, create the links, and just promote the hell out of them on social media. And, for the first few cycles, of course, that was primarily Twitter. But
Yeah.
the last cycle and now it's mostly Blue Sky. But I also cross post. I still cross post on Twitter, even though I don't do anything else. I just post it there and then leave.
Sure.
But
Hmm.
Threads, Mastodon, etc. Um, and but mostly through Blue Sky. And yes, like so far this cycle, I'm coming up on 200,000 for the cycle. Obviously, we're very early in the 2-year cycle so far,
Incredible.
but about $200,000 so far for a variety of races. And a big chunk of it, of course, went to those special elections in Florida at the beginning of April, and then of course the Wisconsin, state Supreme Court race.
Yes. Awesome.
But also there's over 2 dozen special elections that are coming up this year, and so I'm raising a little money for them as well.
Which
Um,
ones were of interest, if I may ask?
for the ones coming up,
Yeah.
honestly, for state legislative races, sorry, I'm just
I think it's so important for us to do the stateside angle because we have Trump, running the federal
And
government. We have Republicans running Congress.
ballots.
So I think it's so
yeah,
important.
for the special elections, the thing to remember about special elections, and just about all of these are state legislative races, right? Because there's over 7,000 state legislative seats, so there's always going to be a few dozen that have special elections at any given time. The thing to remember about those that very few of those are going to be considered competitive.
Right.
Um, there's only about 10% of maybe six or 700 of those that are ever actually, considered competitive anyway, like within 10 points or so, um, at any given time. And for special elections, you have to remember that the only reason there's going to be a special election is because, somebody has to leave in the middle of the term, right? And that's only going to happen if they die or if they, or get very sick, or if they, resign midterm and either due to a scandal or because, because they took another job because they got appointed to some higher position or,
Life choice. Yeah.
whatever. Yeah, more time with their family, whatever the reason. So, and when it's voluntary, I mean, if they die or something, of course that's random. But if they choose to resign for their own reasons, it's usually they're not going to do that if it's in a competitive seat because because the party is going to pressure them not to leave unless they absolutely have to. So very few of these are considered competitive. But even with that, and so I'm looking over the list that I have right now, and of those 25 or 30 of them, most of these are like either D plus 20 or they're R plus 42. These are like deep, deep
Sure.
blue or deep, deep red seats. But there are a handful
Wow.
of them that are, you know, semi-competitive.
Wow.
There's one coming up. Let's see here in like I know in August, there's a House district in California that's R plus 10, so that might be flippable. Granted, it's California, so it's not going to change the balance or anything, but still.
Oh, good.
Um, yeah, there's a couple that are semi-competitive, and also keep in mind that the ones that you wouldn't think are competitive may be because we've actually flipped two in Iowa that were considered deep red, but the Democrats they're overperformed by like over like 20 25 points or something, and they managed to flip a couple seats. So
The Omaha mayor race just took
Whoop.
place.
exactly,
The incumbent won last time by
Mhm.
31 points. The Democrat flipped that and won by, I think, 13, give or take, 12.
I'm not sure what the margin was,
But
but
it
the fact that
was,
they flipped it at all was huge.
yeah.
Especially it was like a 3-term incumbent Republican or
Yep.
something.
Yep.
So it was a big deal. So my rule of thumb is for the general election, I only my rule is for statewide races, Senate, governor, attorney general, anything that's statewide, I list every, like purple state as well as every red state, no matter I don't care if it's Wyoming or Oklahoma. I still list it because there are reasons that people donate that don't necessarily like they know, I think at the state level, people understand that they're not going to flip Oklahoma's Senate seat. They know that. Okay, that's almost impossible. But there are other reasons to donate anyway. Maybe they think that candidate might might have a chance, in the future as a presidential candidate. Who knows? There are other reasons, or maybe it's a party building thing. So at the state level, I think people are smart enough and savvy enough to know that, you know, South Dakota is a deep red state these days. For legislative races, for the general election, I do limit it to, basically between 10 point range, where the district is R plus 10 to D plus 10. For partly because there's just so many. I can't list all 7,000, you
Sure, of
know.
course. Yeah.
And partly because it's not reasonable to me to expect the average donor to know that Michigan's 54th state house district is it blue? Is it red? Is it purple?
Right. Right. Right.
That's not reasonable.
Yeah.
So I do try to, limit that to some degree. That's our district, by the way.
Oh, cool.
Um, so I list like maybe 20 or so within each state. It varies. Now, the exception to that exception is for special elections, I list every one of them, no matter how deep blue or how deep red, partly because there's only, a couple dozen of them at any given time, and partly because turnout for special elections gets weird,
It
as we
does. It
as we found
does.
in some of these specials, that the turnout, the makeup of the people who show up for special elections can be very, very different. And even the states that, or even the specials that they had no chance of flipping, they still have overperformed massively.
Oh yeah. Oh yeah.
On average, there's been about 20 or so specials so far this year. Of those, the Dems have overperformed by an average of 12 points from
That's
what
right.
you expect.
Let's go.
So basically that's
Okay.
compared against last fall, against how Trump did in those districts last fall.
Yeah, of course. And then do you have a plan of attack for this November? We have Michigan, sorry, not Michigan, sorry, Virginia and New Jersey most notably, but there's a bunch of races there too. You have that in your mind in your
Yes, and I am raising money for those. I just want to. I know you mentioned ACASignups.net, my main site. I do want to give a shout out to or a plug for blue26.org. And that is my fundraising. Sorry, I hope you don't mind if I share that real quick.
I don't
Of
know.
course, blue26.org.
Correct. And all that's just the website. And this is not a PAC. I do not have a PAC. I do not have it's not an organization. It's just a simple website I set up that just has, all it is basically just a bunch of links to the fundraising pages. You click on these, they just take you to the Act Blue page for US Senate, US House, whatever. And I have a little blog where I, just show like how my updates, like here's my final fundraising report from last fall for the cycle to show how I did, how much I raised,
Nice.
so on. But mostly it's basically just a repository of links. And so, for example, for the state legislative seats, I don't have most of these set up yet because most of these aren't up until next year. But for New Jersey and Virginia, I do have the pages set up. And it basically is just a link to take you to the fundraising page for that. And so, yeah, I have pages set up for both New Jersey and Virginia. That's for their state legislatures, as well as, oops,
Critical,
sorry,
absolutely critical. I can't thank
as
you
well
enough.
as governor.
Yes.
There's some statewide offices as well. And yeah, I've raised a few thousand for those. I expect that to ramp up later this fall. And then going into next, so yeah, basically this year, it's basically New Jersey, Virginia, and then the special elections. Going into next year, of
Okay.
course, that's when I'll really be ramping it up, and I'll have the pages for every single state, as well as, and I do have pages for, U.S. Senate, U.S. House, and then statewide, for governor, secretary of state, attorney general, et cetera.
I'll be
And
working my end for
And
the
people
voter
can people
registration.
can access
I'm
and
sorry.
excuse me, people can access that at blue26.org.
Yes, blue26.org. Yep. And
Okay.
and like I said, all it is, and I want to stress this again, this is not a PAC, it is not an organization. It's just that page. The only reason I have that page is because it's really because of the state legislative pages. Because if it was just, US House, US Senate, and specials, that's three. Well, there's 50 states. So I wanted to have a single place for people to go where they could just pick their state and find it instead of having this long list of,
We have to make it easy. You're doing exactly what's necessary. If it's complicated and people have to Google and go over the place and
right.
do this stuff, they're not going to do it. What you're doing is incredible, and I can't thank you enough. I mean, we really, really need it. We still have elections, knock on wood, And so we need to win them. We need to show up on my end. I'm going to be hustling hard with a little battalion of nonpartisan voter registration people out here for the elections in November, and then of course for the midterms, we're going to try to hit that hard as well on our end to really hard, to really hammer home the importance of this. But I think fundraising is critical, and I think you're doing such a great job. And again, I just can't thank you enough.
Thank you. And
Yeah,
also,
thank you for taking the time.
I'm sorry, I just wanted to mention what the other sort of, you mentioned burying the lead. The other thing I'll just mention is the other thing is that I do not take a percentage of what I'm raising. Unlike a lot of PACs, which again, I'm not a PAC, where it gets split between candidate so and so and this PAC that you may or may not have heard of. None of it goes to me. I have a tip page, like after you're done donating to the candidates, it'll take you to a page and say, hey, if you want to throw a buck or two my way, I'd appreciate it. But that's voluntary, separate,
Completely,
has no connection to the candidate donation.
It's a labor of love for democracy and competent government, I guess I would say, on your end.
Yeah, pretty much.
Yes.
I actually I received the Nebraska Democratic Party, or that they sent me a mug, a coffee mug, and a couple of as a thank you. Like that's my swag. Other than that, yeah, basically I raised $6 million, and all I got was this lousy t-shirt.
That's great. That's
No,
how you.
I do appreciate it. I did.
No, I mean it's selfless. It's critical, absolutely critical, and so I'm so happy to hear you're doing it.
Thank you.
Yeah, man. Is there anything by any chance that keeps you up at night?
Other than literally everything going on right now, yeah, I mean, obviously there's a lot of horrible stuff going on right now. My biggest, what keeps me up at night is not so much the fear that we won't have legitimate elections, although that is a very real, fear.
Of course.
My real fear is that we will have, legitimate, fair elections, and that people still don't get it, and that that enough people still don't care.
Yeah.
Again, I don't want to rehash everything that happened last fall, but when you have people, people like to people are always requoting the famous poem by, oh, I forget his name, that first they came for,
Right.
first they came for this group, then they came for that group, and then they came for me. Well, and and they always say, well, and I didn't speak up because I wasn't part of this group. Well, what really gets to me, really in the pit of my stomach, is that last year, millions of us, including, I'm guessing you guys, were speaking up, were shouting from the rooftops, for the love of God, don't let this happen.
Oh yeah.
And millions and millions of people didn't get that, including in many cases, some of the very groups that we were warning you will be targeted. So
Exactly.
at a certain point, I don't know what else I can do or say to get it through people's heads. If what's happening now isn't going to do it, I don't know what else is gonna.
Well, let me take that
Well,
job.
keep
Yeah, let Lucas and I handle that part. You do the good work you're doing. We'll all put it together. And we like to end on a positive note typically.
Sure.
Do you have any advice for would-be fundraisers, would-be game changers, would-be people that are trying to make a difference, and especially amongst your experience and expertise? Any quick tidbits?
Sure.
Yeah.
Well, I've been asked many times how I've been able to be as successful at the fundraising stuff as I have, and I would say it's mainly because I'm of transparency. I am very clear about where the money is going, about who the money is going to. I am very clear about how it will be, split up and what your options are and so forth. About the fact that, that I don't take a cut, that it's not going, this isn't going to me unless you want to throw a buck my way. And I also make sure, the other things I make sure to include for each race. I want to give a shout out to Dave's Redistricting, this is a guy who basically tracks legislative level, partisan leans of every district in the country and so forth. Dave's Redistricting, great resource. And I think so the election project with Michael McDonald, where I think that data comes from. But basically, I list what the PVI rating is, the partisan voter index. That's basically how red or blue a given district is listed. I list all of that for every single race so that people have some idea. I try to walk the line between fight everywhere, leave no no stone unturned, and be practical and only go for the swing district. I try to walk the line between those two because there's arguments both ways. But I include all of that, and then from there I leave it up to the donor. So it's about being transparent and clear and not BSing people, I'd think.
And fight smart, right? So
Yeah,
like it makes sense to like pick and choose the battles where you're going to be most effective. Can you give us your two websites again one last time and your social
sure.
pages?
Sure. So for the websites, the healthcare wonkery is ACASignups.net. The fundraising, home base for it's, and again, it's just a bunch of links to the fundraising pages is blue26.org. And I can be found mostly on Blue Sky, just at charlesgaba.com is my handle for Blue Sky. And then if you're on one of the others, just look for Charles Gaba and I should show up. Sometimes there's a hyphen in there or an underscore or whatever, but um, it's mostly Blue Sky though.
Fantastic. Yeah, we just
Man.
started our Blue Sky, and thank you very much. Lucas?
Yeah, man. No, thank you very much, and thanks for doing everybody else as well. You can follow us at the way shit works now. That's going to be a handle at Blue Sky starting today, as well as the way shit works now at Instagram on Instagram, and the way ish works ISH for on YouTube. Because censors and all that good stuff. Charles Gaba, we really want to thank you, my brother. Keep doing the lights work, and we will speak to you soon, man.
Yes, thanks
Great.
again.
Thank you very much. It's been fun.